Hello and welcome back to the AIDS Concern Conference, Powering Through Global Challenges 2022. We're now really delighted to have a session this morning where we'll be looking at some of the very recent challenges that have been affecting the HIV epidemic. And we've got three speakers joining us who will be focusing on different aspects of this challenge. The first one is Dr. Phoenix Mo from the Chinese University of Hong Kong. And she's the Program Director in Community Health Practice and also the Associate Director for the Center for Health Behaviors Research. She's going to be talking about sexual behavior and HIV testing under the COVID-19 pandemic among MSM in Hong Kong. So thank you very much, Dr. Mo, for joining us, and I'd like to hand over to you for you to make your presentation. I'll remind people listening in, if they want translation into English or Cantonese for any of the presentations today, please go into options and select translation. Thank you.
Thank you very much. And first of all, I would like to thank again for the invitation from AIDS Concern and the conference committee. And I am Phoenix and Associate Professor of the School of Public Health and Primary Care of the Chinese University of Hong Kong. So today I'm very delighted to be able to share with you some of the findings and that we have done among MSM during the COVID, which is on the patterns of sexual behavior and HIV testing under the COVID-19 pandemic. So I think just a brief introduction. I don't think I need to spend so much time on that, but we all know that MSM remains a very vulnerable group for HIV infections. We see a high HIV prevalence among MSM group, and also an increasing trend. And also the inconsistent condom use is also an issue among MSM. And a recent study actually find that around 47% of the MSM did not use condom with their emotional relationship partners, and 37.8% did not use a condom with their regular sex partner. So this is a concern for us. And we all know that the recent COVID-19 pandemic have also created additional challenges to everyone, including MSM. And we are now experiencing a fifth wave of the pandemic, and probably the worst wave that we have been experiencing so far. So yeah, with a daily high record of about 50,000 confirmed cases per day in around March time. So as of June 12, we have around 765,000 confirmed positive cases. So for the COVID-19, in addition to the infections itself, there are a lot of the social distancing measures that have been in place actually may have a great effect or impact of the behavior patterns of the MSM. So these social distancing measures may include limited public gatherings, mandatory mask wearing in outdoor public places, prohibition of dining inside the restaurant, or some of them may be even more impactful for the MSM, including the closure of some entertainment venues or public events. We have tried to look at some of the literature to try to see whether the COVID-19 has caused a changing patterns of MSM. And the findings have been quite inconsistent, but overall, they suggest that the COVID-19 pandemic may result in a change in sexual behavior, partner selections, and also change in HIV testing pattern. So these changes may include a reducing amount of sex and number of sex partners due to lockdown and difficulties in finding sex partner. And also they may be avoiding certain kinds of sex with their partner in order to reduce the infection of COVID-19. And some of which may also affect their sexual behavior as well. Some studies also suggested that the MSM may be shifting to some online platforms and social and sexual networking sites to look for sex partners. In terms of the HIV testing, some studies find that there may be a suspicion of HIV testing from the NGOs may shift some of the facility-based HIV testing to self-testing. So we are very interested to see how COVID-19 pandemic actually put an effect on MSM behaviors. So it will be interesting to look at the factors that may explain their sexual behaviors and HIV testing during the COVID-19 pandemic as well. We all know that there's sexual behaviors and HIV testing behaviors are affected by multi-levels, including individual levels, interpersonal levels, and also contextual levels. So we may want also interested to see whether these factors may affect or explain their sexual behaviors and HIV testing behaviors during the COVID-19. So for today's presentation, I will mainly present some of the work that has been conducted by our team, which is mainly to look at the pattern of sexual behaviors and HIV testing among MSM. So the main objective is to look at the pattern of sexual behaviors in terms of their number of male sex partners, condoms, anal sex, and the use of alcohol or drugs during the sex, and also to look at the factors of risky sexual behaviors. We also try to look at the levels and changes in HIV testing among the MSM during the COVID-19 period, and to see whether any COVID-19 related perceptions are associated with their HIV testing behavior. So the study design is actually we conduct 2 cross-sectional surveys because we want to have a very detailed investigation on their behaviors. So we did 2 surveys, one particularly on their sexual behaviors and another one on the HIV testing. So both studies are targeting male age 18 or above who self-report having a sex with a male. So for participant recruitment, we mainly recruit these participants through online outreach and peer referral. And we contact them and conduct telephone survey. Due to the COVID-19, we try to avoid face-to-face encounter. So the data collection period spanned from March 2021 to January 2022. So altogether for the 2 studies, we have 463 in study 1 and 400 participants in study 2. So study 1 is mainly about the sexual behaviors and study 2 is mainly about the HIV testing. So you see for both surveys, their demographic characteristics are similar. So you see around half of them are below 30 years old. A majority of them is homosexual. Half of them in study 1 claim that they were single, and about more than 80% of them have a university degree or above. So so here is just the findings of study 1. So in study 1, we try to look at the pattern of change and sexual behaviors, and also try to see whether there are what are the associated factors from different levels. So first of all, we ask them to report their sexual behaviors in the past 6 months, which is during the COVID-19 period. And we also ask them to record their sexual behaviors before the COVID-19 period. So we try to compare whether there are any changes in all of these aspects, including the number of sex partners, condom sex, methods of approaching their partners, use of drugs and alcohol during sex, and group sex. So those that are bold and in black are those that we see as significant differences between the 2 periods. So in terms of a number of sex partners, the MSM report an average of 1.24 regular sex partners in the past 6 months, which is during the COVID-19 period. And average 2 non-regular partners in the past 6 months. So compared to the pre-COVID-19 period, there seems an increase in the number of regular partners and number of non-regular partners. In terms of condonym sex with each of these partners, 51.6% report condonym sex with regular sex partner in the past 6 months. 31.8% report condonym sex with non-regular sex partners, and 46.7% report a condonym sex with a casual sex partner. So when compared with the pre-COVID-19 period, there is an increase in condonym sex with non-regular sex partner during the COVID-19 period. So in terms of methods on approaching the male partners, it's interesting to see that the MSM report a decrease in both approaching male sex partners from gay bar and websites. So possibly due to the reduced sex behavior general during the COVID-19. And in terms of group sex, okay, 12.3% of our participants report having group sex in the past 6 months, which is a decrease, okay, compared to the pre-COVID-19 period. So these are the receptions related to COVID-19. We also want to see how the MSM, they are seeing the COVID-19 infection, and some of them may affect their sexual behavior. So in general, around 2/3 of them perceive that there is a high chance of COVID-19 transmission through the intimate contact behaviors. And they also, some of them showed concern of being infected with COVID-19 from sex partners. And also around 44% of them perceive COVID-19 as a serious or very serious. And ranging from 12% to 33% report some impact of COVID-19 in different aspects in their life. So this one, we also try to see whether they use any of the COVID-19 risk reduction behavior during the sex encounters. So for example, avoiding sex behaviors, or wearing masks, or sanitizing the areas before or after they have sex. So we find that around 43% of them report avoiding having sex with non-regular partner, and 45% also report that they would only have sex with one regular partner during the COVID-19 period. And around 40% they reported they will have sex partner only at home. So and 66% of them reported they will wash hands before and after having sex. So in terms of the psychological attributes, 58% actually report high level of stress, 40% report depressions, and 14% of them report higher cutoff for anxiety. And they actually report some sort of loss in their personal or social resources. So for example, they present that the COVID-19 has a very negative impact on different aspects in their life. So these are the contextual factors. We also ask them how they perceive the MSM community in general in terms of the changes in sex seeking behaviors. So 15% report having difficulty in finding a male sex partners. And they also report 51% of them report that the availability of sex venues have greatly reduced during COVID-19. And 74% also report that the places where they can find male sex partner has greatly reduced during the COVID-19 period. And 69% also report that the entertainment venues have greatly reduced. So our next is we try to see whether any of these factors are associated with their sexual behaviors. So first of all, is a number of sex partners. So here I just report the factors that have approached statistical significance. So in general here, we see that the perceptions of COVID-19. So for example, perceive that there is a risk of COVID-19 infection, perceive that COVID-19 is severe, and the risk reduction behaviors that they adopt for COVID-19, they are all associated with a decreased number of sex partners, so as indicated as a negative values of the beta. Sexual satisfaction has a positive value, which means that sexual satisfaction is a risk factors for number of sex partners. And difficulties in finding male sex partners is also associated with increase, possibly associated with number of sex partners. And social isolation is associated with a decreased number of sex partners. And they reported that the number of members seeking same-sex partners is also associated with number of sex partners. With regards to condom sex, we also see a similar trend. So the COVID-19 perception is reduced to less condom sex. Condom negotiation is also reduced and condom sex. And our collective efficacy is also associated with a reduced condom sex. For using alcohol or drugs during the sex, we only find two significant factors, which is related to COVID-19 perception. So perceiving COVID-19 risk reduction behaviors is associated with less use of alcohol or drugs during sex. Next is about HIV testing. For HIV testing, we asked the participants to report the HIV testing behavior during 3 periods. Period 1 is before the COVID-19 period. Period 2 is February to December 2020, and period 3 is January to June 2021. So period 3 and period 4, period 2 and 3 are during the COVID-19 period. So from this table, we see that the number of MSM who have not conduct any HIV testing actually increased from period 1 to period 2 and period 3. So you see 35% of MSM did not have any HIV testing in the pre-COVID-19 period. But when it goes to the COVID-19 period, 46% and 50% of them did not receive any HIV testing. So we also try to see whether their types of HIV testing has changed as well. So those that is bold in the black are those that have reached statistical significance. So in terms of HIV testing as an NGO, we see a significant reductions, okay, from 41% in the pre-COVID-19 period to 31% and 26% during period 2 and period 3. For HIV testing at governmental clinics, interestingly, we see an increase from 5.8 during the pre-COVID-19 period to 9.5 in the COVID-19 period. So for any types of HIV testing in general, in the last column, we see that there is a general reduction from 64% during the pre-COVID-19 period to 54% and 49%. So we also ask about the intention. So we give them 2 scenarios. So scenario 1 is when the COVID-19 pandemic continues in Hong Kong. So, and then the scenario 2 is, when COVID-19 disappear, then what would be their intention to receive their COVID-19? So they find that the intention of receiving HIV testing when the COVID-19 pandemic disappear as increased. Okay, there is more people show that they have an intention to receive HIV testing when the COVID-19 pandemic disappeared. And also more people reported that they would be likely to receive HIV testing at the NGO and or any facility-based HIV testing when COVID-19 disappear compared to like when the COVID-19 continues. So these are the significant factors that is associated with HIV testing. So we find that those report increase in sexual behaviors, okay, and also increase in the frequency of seeking male sex behaviors, and also those that receive increased use of PrEP, and those that report an increased frequency of searching HIV information are associated with a higher likelihood of HIV testing uptake during the COVID-19 period. So in general, we find that there is a decrease in number of sex partners, but an increase in continuous sex with non-regular sex partners during the COVID-19 period, okay, according to our research. Some MSM show concerns about being infected, and they use a variety of risk reduction behaviors during the sex encounters. And these factors are related to their sexual behaviors as well. In terms of the HIV testing, we also see a decrease in the utilization of HIV testing, and also in particular is facility-based HIV testing at NGO during the COVID-19 period. The use of HIV self-testing is low and stable before and after the COVID-19. So it's interesting to see that, to see this trend and to have a further investigation, because we imagine that the negative impact of COVID-19 may still be long-lasting. So also we find that the frequencies and the pattern of sex behaviors, the HIV information seeking, and the PrEP use may be associated with the HIV testing behavior. So overall, we see that the controlled measures that has been are in place for the COVID-19 pandemic has an impact of the sexual behaviors and HIV testing. So as the impact of COVID-19 is expected to last, its impact on the sexual behavior and HIV testing may be longer lasting. So it's important that any interventions on safe sex maybe need to highlight both prevention of COVID-19, but also the HIV testing, HIV and STD prevention as well. And we see that HIV self-testing may be a useful strategy to improve or increase the HIV uptake rate during the COVID-19 pandemic. So this is all for my presentation today. And I would like to give our thanks to my team members who have made these two pieces of studies successful. And we also want to thank the AIDS Trust Funds for funding these two pieces of research. So again, thank you very much. And if you have any questions, we will be delighted to discuss in the Q&A section. Thank you very much.